A second example of marginal analysis comes not from the patient side, but from the provider side, or from the government side. So let's say that there was some medication out there that would help to cure patients, okay? Or it can be a vaccine, for that matter. So when we look at it, let's assume for this case that there are 5 stages of the disease. Now, the more severe it is, the greater the benefit is going to be in this case. Now, this wouldn't apply to something like cancer, for example, where stage 5 cancer there's going to be a lot of times very little benefit of treatment, because by that point it's kind of the idea that it's really tough to come back from that. Whereas stage 2, 1, and 3 are going to have a greater benefit. So, but in this case, in this example, if you stage 5, if this person gets this medication or treatment, they will get 30 more years of life. Stage 4, they will get 10 more. Stage 3, they will get 5. Stage 2, where they're not sick, they get 2. Stage 1, they get 1. Stage 0, where they don't have it, they get 10. And these are the patients that would get it. Let me go pull this up here. Okay, so with this analysis, you're the provider and you're trying to decide what should you do. Now, we're taking money out of the equation here, right? And let's just assume that it's free and that everyone here is equally able to, you get the same amount of money whether you treat it stage 5 versus stage 0. Okay. So when that's the case, if your goal as a provider, as the government, is to make decisions that have the largest total benefits, right, you're going to treat the people who are going to benefit the most first, the second most second, third most third, and so on and so forth. And so if we look at this, going under that reasoning, if we decided to, then we would do the stage 5 patients first. Okay. They would get 30 years each benefit. There's 4 of them. And so if you treated all 4, those 4 people are going to give you 120 years of benefit. Okay, it's a lot of benefit. That's good. Now, we're going to do a running total here as well. And that's going to be going under that, treating the people who benefit most first, second most second, third most third, so forth. This is what the total benefit is going to be. So now, if we look at each stage here, okay, stage 4, they get 10 years each. There's 6 of them. 10 times 6 is 60. Stage 5, they get 5 years each. There's 10 of them. 5 times 10 is 50. 2 times 12 is 24. 1 times 20 is 20. And for stage 0, because they don't have the disease, if you treat them, there's going to be no benefit. And so 0 times 48 is going to be 0. Now, if we go in order, so if we treat the first, or stage 5, we would get 120 years. If we then go to stage 4, we would get those 60 additional years, so now have 180, 120 plus 60. If we go to stage 3, add those 50 on, 230. Stage 4, add those 24, 254, 274. And now if we treat that additional benefit, or that additional stage, the total benefit doesn't go up by anything. Okay, because you're not gaining anything. And so if we go back here, all right, and we actually graph what we showed here, this is what it's going to look like. And under this idea that you treat the people who are going to benefit most first, second most second, third most third, so on and so forth, what you're going to see is you're going to see initially the patients that are getting treatment are adding a lot of total benefit. And so the total benefit is increasing very rapidly. But then as you continue to treat patients, because you are getting less and less benefit from them because they're not as sick or they may not be as at risk if you're looking at a vaccine, the total benefit is going up by smaller and smaller amounts. That's where we get to this point up here of flat of the curve medicine. Flat of the curve medicine is basically where you get to the point where if you continue to treat patients, there's no benefit to doing so. Okay. And so, by doing it, by making it, you're not adding any benefit. Now, we're not talking about costs here, just the benefit side, but that's an important term to remember, is this idea of flat of the curve medicine. Right? There is a point where continuing to treat more and more patients really isn't doing anything.